Hi, we're Group 2, and the discussion topic today is the social determinants of health.
Social determinants of health are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. To better understand how the social determinants of health can impact someone's life, let's take a look at a side-by-side case study analysis.
Barbie has just earned her bachelor's degree. She could expect to live around 3 years longer than those with less education, partly due to an enhanced ability to make health-related decisions. She may also live longer because she has access to more jobs with higher wages and benefits due to her degree. Barbie would also have more access to physical resources like childcare, which can improve her well-being.
Barbie is always happy and healthy. This is because she has great insurance, which is under a PPO plan. This allows Barbie to choose her own health care provider, specialists, and even see out-of-network providers for a higher cost when in an emergency. Her plan covers all of her prescriptions, includes a low copay at checkup visits, and she gets to feel safe and comfortable with the provider she has chosen herself. Because Barbie has access to high-quality health care, she regularly maintains checkups, dental visits, and eye care appointments. Barbie is also able to go for routine screenings for preventative health measures.
Barbie lives in her Malibu dream house that has everything she could ever want to live a stress-free life. Barbie lives in a safe neighborhood with little to no crime, so she feels safe at all times. Barbie's neighborhood also has fully paved sidewalks, so she can freely and comfortably go on a walk to get physical exercise on a daily basis.
Having strong social ties built on trust can reduce stress levels and feelings of depression and isolation. Thankfully, Barbie has a tight-knit group of friends that she can count on for emotional support and encouragement. She also grew up in a household with two parents who are gainfully employed and able to provide her with both needs and wants. Barbie also has a supportive boyfriend, Ken, who encourages her to be an independent achiever. She spends her spare time volunteering for community projects, furthering her connection to the community and boosting her mental and physical health.
Barbie's secondary education was paid for by her parents. She graduated debt-free and has a full-time salaried career that offers healthcare benefits, paid time off, and a 401k. Her financial stability gives her access to nutritious food, housing, a car to drive, and paid time off for hobbies and to care for her family. Barbie has a gym membership and access to numerous parks within her neighborhood to support her physical health. Barbie's financial health allows her to maintain a good quality of life through access to her basic needs plus additional luxuries.
Now let's take a look at what Barbie's life would be like if the social determinants of health were not in her favor.
If Barbie did not earn a bachelor's degree, her general health would likely be worse, and she may have a few chronic conditions like heart disease or cancer. Her access to good jobs would also be diminished, and chances of unemployment would rise due to globalization and automation. She may also live a shorter life as a result of lower wages and worse overall health.
In this life, Barbie cannot afford health insurance. The cost of healthcare is a financial burden on her, causing her to delay and avoid going to the doctors. She is unable to go for screenings and obtain necessary vaccinations, making her more vulnerable to viruses and disease. Barbie is stressed about potential emergencies because she cannot afford an ambulance or hospital bill. This causes her mental health to decline. Additionally, Barbie's pre-existing conditions are not improving because her prescriptions are too expensive.
This Barbie is not so fortunate. This Barbie lives in a small 2-room apartment in the middle of a large city. Where this Barbie lives, there's an above-average crime rate, so Barbie lives in constant fear and stress of being a victim of violent crime. Due to the rampant crime and lack of maintained sidewalks, Barbie is not able to safely and comfortably go for a walk, so she does not get regular physical exercise.
In this version of Barbie's life, she was born to a single mother who worked multiple jobs to pay rent and provide only the basic essentials, often being forced to skip meals. Because Barbie's mom was always working, Barbie spent a lot of time alone, causing her to feel isolated. These early childhood experiences had a detrimental effect on her cognitive, psychological, and physical development. She now doesn't have strong social supports, suffers from depression, and perpetually dates men who treat her poorly. This exacerbates her feelings of negative self-worth.
Without a college degree, Barbie works a minimum wage job without health insurance benefits, retirement plan, or paid time off. Barbie struggles to make ends meet and must make choices for housing, food, and transportation based on what she can afford. She uses unreliable public transportation and buys processed food over fresh produce due to its cost. This causes stress and hardship, leaving her vulnerable to increased physical pain, lowered pain tolerance, and risk of coronary heart disease.
As we have shown, Barbie's life looks very different depending on the social determinants of health, and her overall health is drastically impacted based on the differences in the 5 domains we explored. I hope you all learned something today. Thanks for listening.